Okay, let's dive right into this explainer. We're looking at a massive economic and political storm currently facing the managed care industry. We're going to uncover how managed care entities, the organizations offering health insurance for individual, commercial, Medicare, and Medicaid members, are operating in a highly complex, high-stakes environment. Historically, enrollment has been tied to employment rates, while revenue is driven by medical cost inflation. But right now, that landscape is shifting dramatically, and the pressure is absolutely on. To really set the stakes here, just consider this reality. Legislative uncertainty and a laser focus on reducing healthcare costs may create downward pricing pressure and continue to drive industry consolidation. That is the state of the market today. The relentless drive from both the public and private sectors to slash costs, combined with constantly shifting regulations, is acting like a pressure cooker. This downward pricing pressure is quite literally fueling massive industry consolidation. Companies are rotating, acquiring, and restructuring every day just to stay afloat. So this raises a pretty critical question for anyone analyzing this space. As the market squeeze intensifies, how do investors, analysts, and even the companies themselves actually measure an organization's ability to endure? I mean, when everyone is facing the exact same legislative and pricing headwinds, how do you separate the companies that are built to last from the ones that are just going to be swallowed up by consolidation? Well, that's exactly where the SASB Sustainability Accounting Standards for Managed Care come into play. SASB, which is now under the stewardship of the International Sustainability Standards Board, provides the exact toolkit we need. It outlines standardized metrics to evaluate how companies are actually navigating these existential, long-term challenges. By looking at these specific sustainability risks and opportunities, we can gauge true enterprise resilience. We're going to look at 4 specific operational metrics today: data privacy and security, access and plan performance, driving better patient outcomes, and climate change health risks. We're framing these not just as accounting standards, but really as a critical survival checklist for the industry. All right, let's jump into Section 1, data privacy and security. Look, in our digital age, cyber attacks are a constant threat, right? To survive, companies have got to rigorously track 2 main things: the total number of data breaches and exactly how many unique customers are impacted when their systems are compromised. A data breach is basically defined as any unauthorized occurrence that jeopardizes the confidentiality or integrity of an information system. Because managed care entities hold such a massive amount of data, failing to implement robust administrative, physical, and technical safeguards can be absolutely devastating. What's super interesting here is how SASB requires a strict distinction between breaches involving general personal data versus highly sensitive personal health data. Personal data might just be information that identifies someone, but personal health data reveals their physical or mental health status and medical treatments. Breaches involving this specific subset of data carry entirely different weights when it comes to regulatory scrutiny, patient trust, and potential penalties. And that brings us to the bottom line, the financial impact. Failing to protect this data isn't just a headache for the IT department, it's a massive financial liability. The standard requires full disclosure of the total amount of monetary losses resulting from legal proceedings, which includes fines, civil judgments, and regulatory penalties. In a market already defined by downward pricing pressure, massive, unexpected legal losses directly erode a company's ability to compete and survive. Moving right along to Section 2, access and plan performance. Let's look at how the regulatory focus on healthcare costs actually shapes customer access and overall plan performance. This brings us to the medical loss ratio, or MLR. This is a direct, quantitative measure of how companies balance required patient spending against their own profit margins. You calculate it by taking the incurred medical claims, adding the expenditures for activities that improve healthcare quality, and then dividing that by the total premium revenue. In a highly cost-conscious era where regulators are pinching every penny, the MLR shows exactly how much of a premium is actually going toward patient care rather than administrative overhead. Now, to measure how a plan genuinely performs for the people relying on it, the framework also tracks denied claims, specifically the percentage of claims denied that were appealed by customers and then ultimately reversed by the entity. This is an incredibly insightful metric. If a company has a high rate of reversed claims, it's a massive red flag. It highlights a risk that the plan might be improperly withholding necessary care right at the outset, and that kind of friction completely degrades patient trust. All of this directly impacts market share protection. By comparing enrollee retention rates against the plan enrollee grievance rate, we get a crystal clear picture of customer satisfaction. The grievance rate measures complaints about the timeliness, appropriateness, or access to care delivery. If grievances are high, retention drops. It's that simple. In an environment where consolidation gives consumers fewer but much larger options, maintaining low grievance rates is absolutely crucial to protecting enterprise value.
Let's pivot to Section 3, driving better patient outcomes.
Because simply offering basic access, it's just not enough anymore. To survive the squeeze, resilient companies have to actively improve patient health. That's exactly why they're evaluated on the percentage of enrollees participating in specific wellness programs. Things like diet, nutrition, exercise, stress management, mental health, and smoking or alcohol cessation. Why does this matter? Well, effective primary and secondary prevention directly reduces long-term medical costs. Companies that nail this develop strong reputations for high-quality care, which leads to increased market share, bonus payments, and vastly improved margins.
And finally, Section 4, climate change health risks.
This brings us to perhaps the most surprising yet absolutely critical test of a managed care company's long-term viability, the climate chain reaction. We're talking about extreme weather events and natural disasters driving the migration of vector-borne tropical diseases like malaria and dengue fever straight into non-tropical regions, not to mention the increasing risks of waterborne diseases like cholera. This directly spikes morbidity and mortality rates, translating to a sudden surge in healthcare system encounters. Ultimately, this crushes plan affordability, feeding right back into those immense pricing pressures we talked about at the very beginning.
So, to protect shareholder value, companies actually have to disclose their strategic approach to incorporating these exact shifting disease patterns into their financial risk and risk adjustment models. Think about it. If a managed care entity isn't projecting how heat-induced illnesses or decreased food availability will impact their revenue and costs, their long-term survival in a consolidated market is highly, highly questionable.
So, it all comes back to the core challenge. By using these specific sustainability metrics, from data privacy and medical loss ratios to wellness outcomes and climate risk modeling, we can actually cut through the legislative uncertainty. The data gives us the map. The only question left is, looking at the raw numbers, which of these managed care companies are truly built to weather the storm and which ones are already sinking?